that changed my life, my husband's life, my family's life happened on January 15th, 1990 at 8:32 in the morning. I'm Carol Levine. I direct the Families and Healthcare Project at the United Hospital Fund in New York City. I spent 6 years after my husband was devastatingly injured in an automobile accident trying to figure out what I was doing wrong and why I couldn't manage his care. And then I realized it was like an aha moment. It's not me, it's the system that needs to be changed.
My name is Moikansi Kama, and I'm the founder of Image Nation Cinema Foundation. My husband Greg and I do not have health care. There have been times when we did. However, when times get tough, the first thing we do is cut back on the things that we can actually afford to let go. I'm always concerned, what if something happens to me? What happens to the organization that I'm working really hard to build? But when the recession hit, I had to make the decision to cut my health care again. It's a reality of being an entrepreneur.
Last October, I was hospitalized for a blood clot. When I first was hospitalized, my mom called the insurance company and was asking them, if she's hospitalized, will the bill be covered? And they're saying, yeah, everything's gonna be covered, everything's gonna be covered. But when I got out, there was a bill in the mail.
Up until September of 2008, I was covered under my father's health insurance. But because of circumstances where he divorced my mother, he took all the health insurance that we had, so I can't go get a checkup because in the end result, we're gonna end up paying, $500 to $1,000.
It's just ridiculous how much they charge in order for you to feel better and for you to get better.
My name is Kimberly, and I'm with the Restaurant Opportunity Center of New York. As a restaurant manager on a daily basis, I did know of employees who came to work sick. My choice was to send them home, with the pay. But of course, the owners of the restaurant thought differently. Their opinion to me was, oh, you can send them home, that's no problem. We don't mind, but they're not gonna get paid for the day. And you need to make that clear to them.
My name is Betty McGuire. I work for a security company. As a security officer, not only as a security officer, but as any working person, everybody needs a sick day here and there. And I didn't have any paid sick days when I started working for the security company. And I was concerned about that because I had a sick husband at the time. If I took a day off, I didn't get any pay.
Debbie Scheinholz. I've been married almost 20 years. I have 2 children, a 16-year-old daughter and a 13-year-old son. My dad had been in a nursing home and then was taken to the emergency room. Being the closest to them, which was 2 hours away, I was the one who was called when there was an emergency. Because my employer has been flexible, I've been able to just go when I have to go. I do think my employer's decision to allow me to have the flexibility I needed paid off for them and for me. I feel like I'm a much more dedicated employee, a much more grateful, loyal, motivated employee. My job is very, very important to me, but my family is first.
I think affordable health care would allow people to feel more free.
It's important to make the system more flexible.
It's something that should be a right.
And there are so many people who don't have it.
The time to make changes now.